At this session, you will learn about the abundance of benefits in digital healthcare and healthcare innovations. The World Health Organization's Global Strategy on Digital Health 2020 to 2025 highlights that digital health should be an integral part of health priorities and benefit the people in a way that is ethical, safe, secure, reliable, equitable, and sustainable. Our keynote speaker is a dynamic and visionary digital health expert. Derrick Muneene is currently the acting director of the Digital Health and Innovation Department of WHO headquarters in Geneva, Switzerland. Derrick has 22 years of progressive experience in public health informatics, digital health literacy, digital health capacity building, and project management. COVID-19 has definitely stirred transformation and digital acceleration in healthcare. So we are very honored to have Derrick and the World Health Organization powering this conference and to shed light on these healthcare innovations. So without further ado, Derrick will be on air real soon. So stay tuned for this important conversation.
Good afternoon, viewers from wherever you're connecting. I'd like to thank the organizers for this privileged opportunity to speak on the WHO's work on digital health and innovations. My name is Derrick Muneene. I'm Head of Capacity Building and Collaboration at the World Health Organization based here in Geneva. The discussion point for this session is around people-centered health services enabled by digital health and innovation. I'd like to start off by sharing the storyline so far in terms of the journey that the digital health ecosystem, working with our member states, has gone through. A number of you might be familiar that the first resolution on introducing ICTs in health was passed in 2005. That resolution was quite catalytic in terms of introducing ICTs in health. And the aspiration of that resolution was really to harness the power of technology, enabling patients wherever they are to have better access to health services, and also enabling digital and ICT applications to provide, or at least to support the provision of better care, leading to improved health outcomes. The year 2005 was catalytic in this sense, and we saw a number of digital applications being introduced in the health sector with the overall agenda of improving health services, mitigating health systems challenges like shortage of health workers in needed areas, providing services to marginalized populations and people in remote areas. And so that year was quite catalytic, and our first resolution on e-health was quite instrumental to really provide the enabling environment for ICTs to be used in health. Subsequent to that were several surveys that were deployed on our e-health observatory, where the penetration of ICTs in health is documented. The organization, working with our partners and member states, has documented at least 3 global surveys, the last of which was in 2015, that focused on universal health coverage. Other landmarks in our journey so far include the second resolution related to e-health that was agreed by our member states in 2013, focused really on e-health standards and interoperability. And this, of course, was quite a natural transition from the first resolution of 2005, because the more applications, ICT applications were introduced in health, the more the need to ensure that these applications are connected and that these applications are not fragmented. And so this e-health resolution on e-health standards and interoperability was quite key in making sure that the ecosystem of e-health and in current times, digital health is less fragmented, and that the tools themselves are better connected, and ensuring that wherever people are, they're able to access health services using digital tools in a less fragmented manner. And so this e-health resolution on standards and interoperability was quite key in as far as data exchange, in interoperability, both semantic, syntactic, and technical interoperability is put in place. Of course, shortly from that year, we saw the release of guides and documents and toolkits, such as the National eHealth Toolkit that was released in 2013 or thereabout, intended to support our member states to develop national strategies and visions and action plans, including ways to measure the effectiveness of e-health. And so 2013 and thereabout was quite instrumental in as far as creating this enabling environment for this field of work, e-health and digital health, to be deployed and implemented in a manner that is sustainable. In recent times, in 2018, our member states urged WHO to consolidate past efforts by way of introducing a resolution on digital health. We call it the Global Digital Health Resolution that was passed in 2018. This is a major landmark in the field of ICTs in health because it focused on consolidating past actions. It focused on partnerships, it focused on building for scale, measurement, and also frontier technologies such as artificial intelligence, blockchain, augmented reality, and the like. And so this resolution gave way to the focus of this presentation, which is a strategy itself on digital health that really sits on this resolution on digital health. The resolution itself on digital health really focuses on how we can put efforts together globally, regionally, and also at country level to really fast track the attainment of the sustainable development goals. And goal number 3, which is really focusing on health and well-being, is where health has a major role. But there are also other health-related sustainable development goals that our actions on digital health contribute towards. And so as an organization, the SDGs and our global actions described in what we refer to as the 13th Global Program, a general program of work, which is really focused on 3 pillars: health and well-being, protecting people from health emergencies, and universal health coverage. Okay, that's a $3 billion agenda, which of course has been extended to 2015, 2024, 2025. The last program of work was due to terminate in 2023. Along this same storyline was the release of a number of products that I'll talk about in this presentation. This is in a nutshell the story so far, and really what you are seeing in front of you is an agenda aimed at supporting countries to implement digital health solutions for purposes of universal health coverage, for purposes of making sure that we are at least contributing towards the attainment of better health outcome, production of health and well-being. And key to doing this is making sure that instruments of work are socialized, understood, and that the global ecosystem is, progressing towards a similar goal. And that's the purpose of the global strategy on digital health. The global strategy on digital health itself has a vision. It has a span that starts from 2020 to 2025. And it's really focused on improving health for everyone, everywhere, by means of accelerating the development and adoption of appropriate digital health solutions to achieve the health-related sustainable development goals. That's the vision of the global strategy. And in terms of the guiding principles, the methods of work, the global strategy itself acknowledges that institutionalization of digital health in national health systems requires a decision and commitment by countries. This principle, of course, goes without saying that, for us to be able to achieve and attain the digital transformation that we're looking for, it is extremely critical that all actors that are involved in the promotion, implementation, and scaling of digital health express our commitments, and this commitment is usually expressed in national digital health strategies. Second guiding principle is to the direction that successful digital health initiatives require an integrated strategy. And by this principle, we're really urging all actors to really focus on what countries have decided upon in terms of implementing digital health. And these are the digital health strategies. But also really encouraging the spirit of cooperation, the spirit of supporting digital health activities and implementation using a whole of government approach and using a whole of society approach. Principle number 3 focuses on the promotion of appropriate digital health technologies for health. And by appropriate, we really mean fit for purpose, those technologies that provide added value to the health system. Principle number 4 is really focused on addressing the major impediments faced by the least developed countries that are still on the pathways of unblocking barriers towards the successful implementation of digital health. Based on these principles, the global strategy sits on 4 broad objectives. And these broad objectives really speak to the pillars of success as far as promoting digital health at global, regional, and national level. Objective 1 is really aimed at fostering global collaboration, regional collaboration, national collaboration of all actors and all parties, and making sure that we're implementing this service in a cohesive fashion. There are a number of instruments that exist that promote this collaboration, but it goes without saying that we can only succeed, as the global strategy anticipates, on digital health transformation if all actors are pushing in the same direction, working together in constructive manner, and also focused on the general aspirations of digital transformation. Objective 1 also focuses on skills transfer, which is really focused on enabling actors to have the needed instruments of work to be able to foster the transformation we're looking for. And so the spirit of Objective 1 really is collaboration, capacity building. And then Objective 2 is really focused on really looking at national strategies as an entry point. And I'll talk about those pillars in a moment. And the reason why this is critical is that the expressed needs of countries as far as transformation or of digital health or utilization of ICTs in health, those expressed needs are articulated in national strategies. We can only achieve this transformation by making sure that we're promoting the existence of national strategies, their visions and action plans, and really making sure that these national strategies are connected with national health policies, national health strategic plans, and other development agendas that countries might have. Objective number 3 is devoted towards making sure that there is governance of this field of work, digital health, at both global, regional, and also at national level. And this, of course, speaks to ownership of the service. Without governance, scale of digital health solutions is hard to attain. Fragmentation exists without governance. There is a term that's been used in the digital health space called pilotitis, which is, of course, a phrase used to describe a situation where lack of governance exhibits itself, a situation where there's no sufficient governance of digital health activities and implementations. And so this objective is aimed at making sure that the national actors, the regional actors, and global actors are empowered in terms of being able to govern digital health implementation and services. Fourth objective is really focused on making sure that we leave no one behind and that we are promoting digital health services with people in mind. And so this is really where the people-centered approach or people-centricity comes in, because the digital health services do not exist in a vacuum. at the end of the spectrum are people. And so this objective is really focused on creating this enabling environment where people are able to interact with digital health services based upon their felt needs, and that digital health solutions are built in such a way that they meet people's health needs. And so when you look at these objectives, the 4 objectives, they really carry the spirit of digital transformation across global levels, regional and country levels. And the spirit of this objective is to really ensure that the universal health coverage agenda that we are all pursuing towards is attained by the support and acceleration of digital health techniques, methods, and modalities. Now, the global strategies objectives are split, of course, by periods in terms of short terms, medium term, and long term. And so what we're focusing on as an organization is to really identify those actions that actors working in this ecosystem need to carry forward for the short term, medium term, and long term. For example, with regards to objective 1, which is really focused, as I mentioned, on global collaboration in digital health, regional and national collaboration, and also knowledge transfer, some of the short term and medium term and long term objectives include strengthening existing networks and partnerships that exist in terms of supporting digital health and promoting capacity building, are both targeting producers of digital health solutions so that they're able to produce standards-based digital solutions, and also promoting the capacity building agenda for the users of the digital health solutions, making sure that the health workers and practitioners are able to use the digital health solutions. So for the short term, our agenda is really to ensure that we're able to attain that state. And for the medium term, of course, really putting in place policy dialogues and digital health research agendas that are aimed at, reviewing what works and what we can actually proceed in terms of amplifications, in terms of scaling, in terms of promotion. And the long term, of course, is really actions around knowledge management and also creating repositories for digital health, similar to what we saw in the old e-health days, where we had an e-health observatory that still exists, that hosts, knowledge around the state of e-health and the state of digital health. And so that long-term agenda is really key towards making sure that we have ways to create a home where all assets that have to do with digital health are kept. A second objective, which I needed to really focus on advancing national strategies, has a number of pillars, a number of milestones for the short term, medium term, and long term. And so for the short term, once again, this objective aims to at least attain such milestones as supporting scaling of digital health implementations, of course, based on national strategy description, and also prioritization of those investments that work and assessing the impact. And for the medium term, we're really focused on such milestones as being able to ensure that the digital health norms and standards are promoted, sustained, and understood by all actors, and that architectural blueprints are established for the sustenance of digital health tools and services. And for the long term, of course, this objective is around trust building. It's around building digital platforms to assess the digital health solutions for effectiveness. The third objective that's around, governance, as described in the previous slides, has a number of actions for the short, medium, long term, a number of milestones, which include the ability to build a dynamic digital health maturity model. And the maturity model is really intended to measure the penetration at national level of digital health. It really answers the question, what indicators are being progressed at national level, and how are those indicators measured? Okay, this maturity model is quite critical to enable member states really in measuring the progress of the work. And of course, evidence-based technical documentation in terms of what works and what lessons can we learn from. For the medium term, we're really focused on such milestones as supporting regulatory frameworks and making sure that country-level governance structures are strengthened. And for the long term, making sure that policy actions in the digital health ecosystems are in place and carried out, and that knowledge transfer for decision makers is actually sustained and executed, and that regulatory frameworks for artificial intelligence and other frontier technologies are in place. The last objective that focuses on people centricity has the following short, medium, and long-term objectives. Short-term, such milestones are envisaged in terms of really getting minimum standards for the performance of electronic health records in place and ethical frameworks for digital health, including regulations around data security and governance. For the medium term, topics or milestones around promoting digital health interventions that are people-centered, and also health data interoperability arrangements. And for the long term, the idea of a personalized medicine put in place, and of course, research agenda sustained. And this is one of the objectives that is key for us to really achieve, or rather fast track, universal health coverage and people-centered health services. Now, there are a number of instruments that we're promoting that a number of actors have contributed towards developing. And these toolkits are really staged to support member states, global actors in the road towards, supporting the digital transformation that we're looking for. We released recently a number of products, such as what you see on the left side of the screen, the Digital Implementation Investment Guide, which is a methodology of revamping an existing national e-health program or digital health program, or indeed introducing a new digital health program. This is one of the guides that we released late last year that is intended to support the implementation of the global strategy and national strategies. Related to this handbook is a handbook that you don't see on the screen called the Digital Health Platform Handbook, which is an architectural guide. It's actually on the screen, by the way. It's towards the center of the screen. This particular Digital Health Platform Handbook is intended to support member states to build this ecosystem of services that enable digital health interoperability frameworks to be established. Some of the guides that have existed in the past include the National eHealth Toolkit, as I alluded to, released in 2013, that promises foundational elements and pillars for countries to put in place to be able to fast track the attainment of national digital health or e-health visions. So a number of these guides are there to help member states in the promotion and implementation of digital health services. I just want to reflect briefly on the 2013 toolkit that was on the previous slide, which has really been quite transformational, was relevant in the e-health days from 2005 to the introduction of the digital health resolution in 2018. This toolkit is still relevant today. The toolkit has provided 7 pillars that serve as the building blocks of supporting a national e-health vision. It articulates actions to take to build national leadership and governance for an e-health strategy. And this is where the global strategy connects with the toolkit as well, because this first pillar on leadership and governance is really focused on making sure that national actors are in the driving seat, are coordinating and managing the national implementation of digital health services. The strategy and governance pillar is really focused on making sure that investments, needed investments, are articulated, and normally this would be articulated in a national investment plan for digital health and e-health services. The services and applications pillar is really focused on creating a portfolio of digital health applications that meet the needs of the national digital health vision. And as an organization, we supported countries to be able to host this portfolio of applications in what we call a digital health a digital health repository. It's called the Digital Health Atlas. Next to that, of course, is the topic around the pillar that has to do with standards and interoperability. This is quite key, especially in this age where we have several different solutions that come to the market or are produced by actors in countries. The key issue that the pillar addresses is making sure that semantic standards, syntactic standards, and technical standards for interoperability are put in place. And once again, this is one of the areas of the global strategy that I just described. Infrastructure in terms of creating an enabling environment where connectivity is in place is one of the pillars that the toolkit describes as an enabling environment for the national digital health strategy. This is quite key, especially in these days where we see more and more digital solutions requiring connectivity of some sort. This is where partnership is key with telecommunications providers, for example, supporting the ministries of health to ensure that the digital solutions themselves exist in a connected environment. Now, legislation, policy, and compliance is a key pillar because this is where regulations show up to ensure that the digital health programs do not exist without a regulatory environment. And so regulations are quite key for us to be able to ensure that the service of digital health is not without regulations. And this ensures protection of data, for example, making sure that patient rights are sustained, and etc. Then lastly, but by all means not the least, is the people themselves, the people that are charged with supporting the digital health transformation, making sure that there's an adequate health workforce that is able to use the digital health services. That pillar is quite critical, and I'll speak to that pillar in a moment. And so with these pillars, we see that the countries themselves are well enabled in terms of advancing the digital health agenda. But people themselves are quite critical. And so as an organization, we have been working towards supporting the production of people, shall I say, who have been focused on skills building from the people side, focusing on policymakers, planners, practitioners, and patients, and making sure that training programs exist to use digital health solutions, to manage digital health solutions, to create interoperable systems and services. And so this is a competency-based agenda that we've been pursuing that starts off with a competency framework that describes the needed change behaviors around knowledge, skills, and attitudes. And this competency framework is really intended to support producers and users of digital services to be able to use, manage, and expand those services. And so our competency framework is really governed around these 4 Ps, and is really intended to support the production of courses that are competency-based. And lastly, a number of initiatives are being conducted by the Department of Digital Health with a view of supporting the global strategy. We are working on a number of projects, a number of programs, including smart guidelines. And these, of course, are intended to support the production of standards-based digital health solutions. It is an approach that enables producers of digital health solutions to consume WHO norms and standards directly into digital health applications. We are also focused on supporting the agenda of scaling innovations in health and sustaining those innovations. We also have an agenda focused on promoting and fast-tracking artificial intelligence in health, and of course, other related frontier technologies. We also are involved in supporting what we call digital channels, which is really getting WHO content, health messages into the hands of people. I just want to conclude that the digital transformation that we're pursuing requires concerted efforts on the part of everyone. We cannot succeed without this coordinated, well-managed digital health agenda without the support of all actors. And we cannot succeed without ensuring that our member states are in the driving seat. And so working together, indeed, it is time for us to make sure that the digital health transformation that we're pursuing is safe, sustainable, and that it leaves no one behind. This is the end of the presentation, and I would like to thank you for listening to this presentation and wishing you successful deliberation moving forward. Thank you.